Module 8, Dietary Strategies to Enhance Cardiovascular Performance. The first strategy that we're going to look at is glycogen loading. It's also known as carbohydrate loading and has a very rich history and has been well studied throughout the literature over the decades. It first begins in 1924 during the Boston Marathon, where candy was fed to runners and was found to improve plasma glucose concentrations. In 1936, Grace Eggleton's textbook is published, and he recommends eating candy during a race and has some evidence to show that new records in long-distance running were associated with this practice of eating candy during a race to maintain those plasma glucose concentrations. And in 1967, we have Gatorade invented, which has carbohydrate as well as electrolyte in it, and was developed for a college football team. The theory here behind carbohydrate consumption is that we can maximize glycogen stores. And if we maximize glycogen stores, we have a lot more to tap into, which is going to enhance our endurance exercise performance. So that will prolong our endurance time. So I can go a lot longer if I pack a whole bunch of muscle glycogen into that tissue. So here's a figure that basically shows what would happen on a low carbohydrate versus a high carbohydrate diet. It's very representative of what you would find in the literature. On the y-axis, we have glycogen, so a percent change from day one of consumption, and on the x-axis, we have weeks of training here out to 4 weeks. The green lines represent a low carbohydrate diet, and the red line represents a high carbohydrate diet. And essentially the message that we see here is that on a high carbohydrate diet, we have much higher concentrations of glycogen within the muscle tissue. Now that presumably would translate into better performance. So how do I promote muscle glycogen storage? How do I pack more glycogen into muscle than would normally be stored if I wasn't doing the strategy of glycogen loading or carbohydrate loading? Well, the first thing that we need to look at is how much carbohydrate to ingest overall. And that is recommended that we stay within 7 to 10 grams of carbohydrate per kilogram of body mass, which represents about 70 to 85% of total kcals consumed for the day. So the bulk of what the athlete is going to be consuming that day is coming from carbohydrate. If the athlete gains about 2 whole kilograms, that's an indication that the athlete can use to basically say that they've maxed out their glycogen stores. Now, there are a couple different models that we can use for this. There's a 7-day classical model, which involves initially depleting the muscle of glycogen. So the first 3 to 4 days before a competition in a 7-day cycle there, you're going to deplete muscle glycogen. So you do this by hard training and a low amount of carbohydrate intake. Followed by about 3 to 4 days of loading with a high carbohydrate diet, and then during this period you taper the exercise a bit. And so then that's when you get this what's called glycogen supercompensation, where you actually put more glycogen into the muscle than you would if you hadn't done this kind of a regimen. So muscle glycogen stores are maximized and optimized, and again, presumably this would translate into improved endurance times. More recently, a modified model of this was proposed because this is a very difficult regimen to perform, that is glycogen deplete and then have a low carbohydrate intake. So with the modified model, you actually don't have a depletion phase. You have an exercise taper phase, and you just have the athlete consume a larger amount of carbohydrate. And as I'll show you in a graph coming up here, this actually has very, very similar effects compared with the depletion model of the 7-day classical model. So this model is a little bit more practical because you're avoiding the fatigue of continuing to train really hard and then have a low carbohydrate intake. So here's the figure I was telling you about. And on the y-axis, we've got glycogen concentration in muscle, and on the x-axis, we have the days that we're performing this strategy. So The red line represents the modified model. The green line represents the classical model. So at day 0 here, with the modified model, they're basically exercise tapering, so there's less exercise that's going on, but still a high carbohydrate intake. With the classical model, you have this depletion phase within the first 3 to 4 days. So in this model, it's 3 days where you basically continue to train really hard and have a low consumption of carbohydrate. So as you can see, as far as glycogen stores are concerned, the end result after performing both of these types of strategies is fairly similar as far as the amount of glycogen concentration in muscles. So for some athletes, the modified model may actually be a better way to go, again, because you're going to avoid the fatigue that comes along with continuing to train really, really hard and taper back on carbohydrate consumption. So when should athletes use glycogen loading? When is it appropriate? Well, first off, the type of activity that they're performing has a lot to do with whether or not glycogen loading is going to work for that athlete. So if they're performing high-intensity endurance activities like a marathon, a triathlon, cross-country skiing for long distances, then they may be a good candidate for this type of strategy. The activity that they perform or compete in has to be more than about 90 minutes of continuous work. So again, cycling, running, all of these activities would have to be kept up continuously for more than 90 minutes. This typically will extend the duration that athletes can perform those particular activities by about 20%. So as far as improvement in performance, as far as distance is concerned, that's about 2 to 3% improvement in their distance that they can go. So they can go a lot longer and maintain their pace for a lot longer as well. The athlete is consuming less than 7 to 8 grams of carbohydrate per kilogram. If the athlete's only consuming this amount of carbohydrate, then they would be a good candidate for high consumption of carbohydrate, the 7 to 10 grams per kilogram of body mass. If the athlete's highly motivated, that's also a significant factor, because if the athlete isn't motivated to dietarily modify their carbohydrates, then they're probably not going to stick with the regimen. They also shouldn't have any medical contraindications. So, for example, having diabetes would complicate this scenario and probably would be inappropriate for this athlete with diabetes. So when should an athlete not use glycogen loading? Well, if the activity is less than 60 to 80 minutes, then they're probably not going to get any benefit from doing these kinds of strategies. If the activity is of short duration and high intensity, for example, like a sprint or weight training, then you may actually hinder the performance of the athlete, because remember now, if you do this right, the athlete's going to gain about 2 kilograms of overall body weight. So is carrying around that extra body weight in carbohydrate stores and water weight, is that worth it in the event that they're participating in? Well, in these types of events, it may not be, and it may actually hinder performance. If the athlete is consuming sufficient carbohydrate for glycogen repletion, so about 8 to 9 grams of carbohydrate per kilogram of body mass per day, then there really is no need to do glycogen loading. Again, if the athlete has specifically uncontrolled diabetes, or they're not managing their diabetes at all, then they probably shouldn't be doing this kind of regimen, at least not on their own. If they're hyperlipidemic, again, high blood levels of lipids in the blood, they probably should consult their physician first before attempting any of these strategies. Okay, some special notes about carbohydrate loading. It's not effective, again, for events lasting between 45 to 90 minutes. So most athletes won't respond to carbohydrate loading. Gender seems to be an issue with carbohydrate loading. Most studies that have been done, unfortunately, were done on male athletes. However, there are a good number of modern studies now that have included women, and we are finding some slight differences there, as we'll talk about in just a minute here. So we just assumed for years that it would work in women, but because of changes in the menstrual cycle, we really need to focus on a lot of studies on women to make sure that we can see what the real effect of carbohydrate loading is going to be in that athletic population. So it turns out that females may actually be less responsive to glycogen loading, and a lot of it has to do with the menstrual cycle and fluctuations that you would get. Some studies report no muscle glycogen supercompensation, while others are reporting that during the luteal phase, there is actually greater storage of muscle glycogen. And if you think about what the luteal phase represents, that represents the time where if fertilization has occurred, then the body would be preparing for the development of a fetus. And so we'd be hanging on to glycogen and storing that for use during that period of time of development. There's actually, during this phase, a 13% increase in muscle glycogen. So we can get more muscle glycogen compensation. However, is that going to translate into anything real for the athlete? That's still up in the air. Some studies do show an increased time to exhaustion. So in other words, the length of time that it took to get to an exhausted point where they simply couldn't cycle anymore, these female athletes actually did better during the luteal phase. So there may be something there, but we still need more work. There seems to be a lower magnitude of supercompensation compared with males, so their muscle glycogen levels perhaps may not achieve the same maximal storage rate that you would see in men, even when you compensate for the differences in muscle mass. While there are some other studies out there that show that you can get similar glycogen supercompensation and no improvement in performance. There are some researchers who feel like, well, perhaps this is just an inadequate calorie intake and inadequate carbohydrate intake. I think the most important message to come away with from this particular work is that we need to experiment at this time with the athlete and practice this plan way ahead of time to see if, in fact, is there a real effect that we can get from doing glycogen loading in this female athlete. So I think to make generalizations at this point wouldn't be a prudent decision, but practicing a plan ahead of time with that particular athlete, individualize it, is probably the smarter way to go when it comes to the use of glycogen loading. So the other issue with carbohydrate loading is that it may actually decrease the enzyme branched-chain acid dehydrogenase, which again is involved in that whole process of utilizing branched-chain amino acids to turn that alanine free and send it out into the bloodstream so we can convert it back into glucose. So there may be some evidence out there that contraindicates this, the use of carbohydrate loading for this particular purpose. So moving on to other strategies, in the 1990s, fat really got a bad rap, and was, companies tried to market their products towards removing fat from products. However, more recently, fat has been embraced as perhaps a macronutrient that could be utilized to spare muscle glycogen and prolong endurance capacity performance. So by promoting fat oxidation, can you spare muscle glycogen, and then can you improve the endurance performance of that particular athlete? So there are studies that have been looking at this, and they've looked at several different components here. We've looked at when the timing of the fat, as well as what kind of fat. So as far as a single high-fat meal before exercise with no adaptation to fat and fat loading, so within 4 hours of competition, feeding somebody about 60 to 70% fat, that did increase fatty acid availability and also the oxidation that the athletes performed. However, there wasn't any improvement in exercise performance as indicated by a time to exhaustion test. The likelihood of gastrointestinal distress was common, with bloating, and diarrhea, and stomach cramping, and a sense of being full. So fat does have that as an issue here. If it's being consumed in these kinds of quantities, 60 to 70% fat meal is a huge amount of fat for a given meal. So there is the fear that we can actually hinder performance by doing this. So this again was just a single high-fat meal prior to exercise with no adaptation. What about fat loading, actually having the person adapt to fat? Well, a typical regimen would be more than 60% fat and less than 15% carbohydrate, and you could do this in an acute manner, so 2 to 3 days, or chronically 7 days out to 4 weeks. This is what most studies have looked at. So let's take a look at both acute and chronic fat consumption and see what we get. Well, in most studies, there was an increase in fat oxidation. That's no surprise. Since we consume more fat, we're going to utilize more fat for energy use. There was a significant reduction in muscle glycogen, and in some instances, performance was impaired. So the improvements in fat oxidation actually didn't offset the decreases in muscle glycogen and the impairment in performance. What's interesting too is that there was a higher RPE for the same intensity on both diets. So there may be something going on there. RPE is a measure of exercise intensity, how hard the athlete thinks they're working. On a high-fat diet followed by an acute high-carbohydrate diet, here's what was found. If you train on this high carbohydrate diet and then about 3 to 5 days prior to competition, you fat load using the regimens that we just described, and then you carbohydrate load 48 hours before competition, what's going to happen? Well, in some studies, we see a decrease in glycogen stores, but once you restored the carbohydrate feeding, that muscle glycogen was brought back to the initial level. And this resulted in no change in performance, which begs the question, and why go through this regimen and introduce a large amount of fat in the person's diet to simply get no improvement in performance and possibly get any gastrointestinal distress? So it doesn't seem that fat loading, at least according to these studies, are helpful for athletes who are performing events like marathons. However, the athletes who are doing the ultra endurance events, greater than 5 hours of continuous work, there may be something to fat loading for this group, but we still need more research in this area. That becomes a little bit more problematic to study, and thus you're not going to find as many studies in the literature regarding those athletes. So the potential risks here, gastrointestinal distress is always a concern. With fat, fat takes a long time to digest, and so if you're trying to perform physical activity, exercise at a high intensity level for a prolonged period of time, you're diverting blood flow away from the GI tract to the working muscle, because the muscle gets a demand and gets the priority for that blood flow. So then that fat just remains in the GI tract, and it's slow to absorb and can cause some distress. There's also the possibility that, depending upon the type of fat that was used, that perhaps that'll increase cardiovascular disease risk. We don't know the answer to this question, but that's the potential risk involved, as well as an increased risk for insulin resistance. So then the question becomes, well, what about the types of fats that we can consume? The long-chain fatty acids versus medium-chain fatty acids. Is there a difference here? Long-chain fatty acids, as we saw in the lipids module, take a long time to digest and absorb, whereas medium-chain fatty acids, as well as short-chain fatty acids, they can absorb quite easily, get into the bloodstream, and get delivered to the working muscle without having to go through all of the carnitine transport and all that stuff that we saw in the muscle. So it really does beg the question, can we use these types of fatty acids? So in some studies looking at long-chain fatty acids versus medium-chain fatty acids, of course, long-chain fatty acids took longer to digest and absorb. There was no effect on fatty acid oxidation. However, medium chain fatty acids were oxidized more, 43% versus 9%. Again, that should be no surprise because medium chain fatty acids get delivered much quicker to muscle, therefore the muscle can take advantage of them a lot sooner. However, the downside here is that exercise time to exhaustion was similar, so it doesn't seem like there was any effect there. There have been a number of studies that have looked just at medium chain fatty acids and trying to play around with the different types of medium chain fatty acids. It seems that at about 10 grams per hour there was no effect on endurance performance. However, if you went to 30 grams per hour, you'll actually increase fat availability and fat oxidation. However, at these levels, you might actually introduce some GI tract distress and you might get reduction in performance. So again, we need to look at this more closely in the literature and tease out whether or not there's something real here, and can we use medium chain fatty acids to spare muscle glycogen so that we can improve performance. Now, what about carbohydrate modified diets like the Zone diet? The Zone diet came out a couple decades ago now and was targeted towards athletes. And there's a whole section on this diet a little bit later on, but the basis for this is that it was a higher fat, lower carbohydrate, but it also fell short as far as calorie concerns or calorie needs, and so athletes may not be ingesting the amount of calories that they need in order to sustain the given amount of training and competition calorically. So their performance may actually be reduced on these kinds of diets. How about caffeine? Well, caffeine is one of those substances, as long as you're caffeine naive, it actually does have a real and appreciable effect. You can improve endurance performance. And there are a whole slew of studies, particularly in cyclists, that attempt to show the effect of caffeine on exercise performance. The amount that the athlete would have to ingest is anywhere between 2 to 6 milligrams per kilogram of body mass. What about L-carnitine supplementation? As we saw earlier, carnitine is a transport protein that brings those long-chain fatty acids into the muscles so you can perform beta oxidation on them. Well, it doesn't seem to benefit individuals as far as athletic performance is concerned. Where we may see a real effect here is, in fact, with people with peripheral arterial disease, and supplementing their diet with carnitine may actually improve performance as far as muscular endurance is concerned. But for the athlete, there doesn't seem to be anything appreciable at this time that I've seen in the literature. Okay, so moving on to protein and the central fatigue theory. This theory basically revolves around tryptophan, and tryptophan being the precursor for serotonin, which is a neurotransmitter in the brain. If serotonin levels in the brain are increased, then you are going to feel relaxed and sleepy or drowsy, and it possibly can make you fatigued. So why would we get more tryptophan? Well, there are several theories to this, and the first of which is that the branched-chain amino acids, leucine, isoleucine, and valine, they're being drawn from the blood by muscles during prolonged endurance types events, and that causes branched-chain amino acid concentrations in the blood to decrease. So the point here to remember is that branched-chain amino acids and tryptophan both share the same transport protein, and which is albumin. And so when you lower the amount of branched-chain amino acids in the blood, you actually allow more tryptophan to bind with albumin, and therefore more of that tryptophan is going to be delivered to the brain, and it's going to offload off of the albumin and then be transported across the blood-brain barrier, which then would increase, theoretically, the production of serotonin. So when that serotonin concentration increases, then you may possibly get an impairment in prolonged exercises and a decrease in performance. So you may actually result in muscle fatigue. So what's interesting, however, is that if you block serotonin with a medication here, buspirone, then you actually increase RPE and endurance exercise decreases. So there may or may not be something real as far as branched-chain amino acids and the amount of tryptophan concentration in blood. So the idea here is that if we consume branched-chain amino acids, so if we supplement the athlete's diet with branched-chain amino acids, we actually may reduce the amount of decrease in branched-chain amino acid concentration in the blood, which means then you'll get less tryptophan going into the brain and less serotonin would be produced. Theory number 2, revolving around protein and central fatigue, says that if you have prolonged exercise or if you consume a high-fat diet, that's going to release tryptophan, more so from albumin, and allow more of that tryptophan to cross the blood-brain barrier. Fatty acids are also transported on albumin, so perhaps because of the increase in fat oxidation and the release of fatty acids in blood, that you now have this competition between fatty acids and tryptophan for albumin for transport. And so if you release more tryptophan, then more of that's going to cross the blood-brain barrier, and then of course we increase the production of serotonin and you get fatigue. Theory number 3 says that, well, if you have a high consumption of foods that have tryptophan in, like turkey, that's the classic example, then again, you're going to increase the production of serotonin. So the idea here is that in each of these 3 theories, if you consume branched-chain amino acid supplements, then you can offset the effect of tryptophan traveling across the blood-brain barrier and then producing more serotonin. So if you can prevent that from happening and decrease it, then the idea is that you won't have an athlete that actually fatigues sooner because of this effect. However, branched-chain amino acid supplementation is something that needs to be studied more and investigated further before we can make mass general recommendations. So individuality and practicing a supplement plan for the athlete prior to any competition is really the smarter way to approach this. So if the athlete wants to try something like this, they've heard about it and they want to see if they can get an improvement in their performance, there's certainly nothing wrong with practicing this plan and seeing in fact if there's a real and appreciable effect for that particular person.